Welcome to CHFT's Electronic Patient Record Training for Doctors. This e-learning will show how to navigate around the system, how to customize and save favorites for your personal login, where and how to record patient care on the patient record, how to create a document and how to discharge the patient. The patients used for e-learning are on a trained domain, and are totally fictional. This is part 4 of 4 sections for inpatient doctors. Part 4 covers the following: procedures and diagnosis, clinical summary, split screen, select other note, documentation, personalizing document type list, the depart process for discharge, task and exit and supporting documentation information. To add a procedure to a patient's record, you should access procedures and diagnoses from the main menu. Procedures will pull through to the discharge summary. The process is exactly the same as for problems and diagnoses. We will run through the process. Let's use the search function for this process. You can click and add to history. Right-click will open the list of actions you may want to undertake, for example, modify. Now we need to complete the clinical summary. Click Clinical Summary from the Clinician Workflow menu. You can record directly into the summary, or you can split the page, to enable access to information already recorded, that you might want to include. If you cannot see the split page icon, pin your main menu, or decrease your view size. Click on the split page icon. You have now split the page, with your summary on the right-hand side. You can free text into the summary. You can scroll for information required. You can copy and paste into the summary. Or you can use the auto text function. Once you have completed your summary, remember to click Save within the summary component. We will now put all the information into one document. Click the Select Other Note link. The system needs to know what type of note we are wanting to create. Click on the drop-down for type. A full list of all document types is available here. We can personalize our own documents to save time in the future. Click View on the top toolbar. Click on Customize. The window reveals all document types on the left-hand side. You can move selected documents to the right-hand side to create your own personal folder. Select documents one at a time and use the blue arrow to move them across to the personal note type list on the right-hand side. Click Apply and then click OK. Using the drop-down, change the All to Personal on the Note Type List filter. Using the drop-down, look at Types again. Your chosen documents are now in your personal folder. Give your note a title. For example, Ward Round with Dr. Fraser. We will use Clerking Note with Dr. Brown. Your personal folder will remain as it is until you change it. You can still access the All menu by changing the Note Type List filter field. We will now select Clerking Note. Select a note template for your document type. Click OK. All the information you recorded has now populated into a clerking note. Each component from the clinician workflow is shown in its own category. Scroll up and down to check your document. You can click into any category to add text, amend, paste and/or delete. Once you are happy with the document, click Sign and Submit. Save and close are only to be used if you haven't finalized your document and need to come back to it later. These functions will save the document so only you can see it. The Sign and Submit button saves it to the patient record. A window will appear. Check you have the correct type of document and other details have been completed, for example title. Click Sign. Click on Documentation, this is where all documents can be found. Refresh the page. Click on the document to view it on the right-hand side. The last part of this training is to discharge the patient. Click on the Depart button on the top toolbar. The Depart process consists of several categories on the left-hand side. The right-hand side is the clinical copy for the GP, and also a patient copy. Once a category has been accessed, it will change from mandatory yellow to the color gray. Use the pencil on the right of the category to open it. You can return to any category, except Finalize, as many times as needed during a patient's stay. Finalize is the last category to be used on the patient departure, and it is usually the nursing staff who do this. Click on the pencil to open Key Discharge Dates. This is already gray as we recorded an EDD date on admission. Update the discharge date and time. We will use T for today and N for now. Click the green tick to save and close the window. Open and record on Medically Stable for discharge. ensure a diagnosis is recorded. Ensure it is set as discharge and that ranking is selected as appropriate, for example primary. If ranking is not selected, all diagnoses will be shown alphabetically on the summary. If a diagnosis is vague, add for example treated as presumed pulmonary embolism in the clinical discharge summary, as well as adding a comment on the diagnosis itself. The comment is required for coding staff and the summary is required for the GP. You can add the diagnosis as we did earlier. The system automatically sets the type to discharge, as we are in the discharge summary. Or you can right-click and modify a diagnosis that is already recorded and amend it to the discharge diagnoses. Update as necessary, ensuring you change the type from working to discharge. Don't forget to change the ranking if appropriate. Next is the medication reconciliation. We can see home medications, any continued home medications and medication prescribed during the patient's stay. For any medication that you want on the TTO, use the pill box. These medications will move to the right-hand side, orders after reconciliation. Continue to reconcile. To cancel any home medication, right-click. This allows you to document why you are stopping the medication at the point of discharge. Complete as appropriate. Anything else prescribed during the inpatient stay can be left as it will stop automatically. We now need to reorder the warfarin. You can go to Requests and Care Plans, or from here you can click Add. Search and complete the order as we have done previously. The type shows as discharge meds as we are on the discharge summary. If using Requests and Care Plans, ensure you change this to discharge. We will say GP to review. The warfarin is now ordered. Complete clinical details for all other medications that the patient is going home on. Click the blue circle to complete the missing details. You can pull up the field using your mouse if required. Scroll down to ensure all fields are completed. You need to record is these were admission meds or not. We will also say GP to review. Continue until all orders are complete. You can now click Sign. Click on Clinical Discharge Summary. Details from the summary recorded in the clinician workflow do not pull through to the discharge process fields. You can copy any notes onto a document, for example Word, then copy and paste into the relevant fields on the discharge summary. Do not use abbreviations, for example SOB, write out in full as the patient has to understand your comments. We will copy some text into the mandatory fields as an example. You can see the different categories as we work down the page. On completion, click the green tick. Let's now complete the key discharge details. Check your summary and ensure everything is in order. Nursing staff will finalize the document once completed and the system will generate a copy to the GP. It may be advisable to leave the diagnosis until the very end. If nursing staff see a yellow category remaining, they won't finalize too soon. When checked and all is in order, click Close. Your document has been saved and now sits on documentation. If we return to the depart process, you can see that a copy has been sent to the GP. When you have finished your shift and are closing down the application, always use Task and Exit at the top left-hand side of the screen. This will ensure any changes you have made to personalize your login will remain. Using the red cross at the top right-hand side of the screen will go back to default the next time you log in. Alternatively, use the Exit button. This will also save your personalizations. You can access standard operating procedures, SOPs, bite-size e-learning, or revisit this video as many times as you wish from any trust PC via the desktop or intranet. There is also the doctor's handbook to refer to, and you can join the pharmacy WhatsApp group for prescribing help. They also have videos on YouTube. You have now completed Part 4 of the doctor's inpatient e-learning. Remember to also see Parts 1, 2, and 3. Thank you.